Good evening. And we understand that there are over 350 registrations for this webinar. So thank you all for responding to our request. And thank you to all the participants. And thanks to all our esteemed panelists for agreeing to be on this very important panel. Just a brief background that this event is being hosted under the banner of WASH Governance Hub. This WASH Governance Hub is a partnership of CEPT, the CWAS, the Center for Water Sanitation at CEPT, SIWI, the Stockholm International Water Institute, and NIUA. We had a launch of the hub at Delhi in February, where we had participation from various ministries and range of stakeholders. But the circumstances from February to today, we could not take on any activity on ground. So, but this is something that we all felt was an important activity because each partner has been doing work in how to respond to this pandemic and from the water sanitation perspective. So once again, welcome to all the panelists. Thank you all. And I will now request Alejandro Jimenez from SIWI to make his presentation. And I'm not going to introduce the panelists because I think if you've seen the webinar announcement where we have detailed this bio of each of our panelists. Alejandro, thank you. Go ahead.
Thank you very much and welcome everyone to this webinar. I'm very happy to see so many people joining us today. And yeah, my intervention would be from the perspective of what SIWI, the Stockholm International Water Institute, has been doing in terms of looking at the COVID response from the WASH perspective, right? And actually what I will bring first to this webinar is a global overview, while later rest of panelists will take a look at what different experiences from India. So next slide, please. From our side, what we have been doing is trying to look at the situation related to COVID, because as you know very well, this is a global crisis, and like this time is really true that it's global because we have so many over 200 countries almost affected in different ways. But at the same time, it's an opportunity to learn in real time from each other and to see what is happening in different parts as the countries transition at different speeds from the different phases of the pandemics. So SIWI, supported by UNICEF, has been mapping the public policy WASH response in around 80 countries from the month of March up to now. This has mostly coincided with most of the lockdown phase, while in some areas there are already countries that have been reopening and coming to what is called de-escalation and new normality phase. This public policy and response mapping has been done using existing publicly available information, internet, social media, available reports, etc. So it has not been discussed in every country with the local stakeholders because that would have been impossible. On the right of the slide, you see some maps related to how we have been representing the different amount of measures taken in different countries in different regions. Next slide, please. Then how we have been mapping this response framework has been around 3 areas. First one, intensifying awareness raising campaigns for hand washing with soap and water and efficient water use at home, right? And second one, strengthen the infection prevention and control at the households and in institutions, another key aspects that I'm sure you are all aware of. Third, preserve the ability of all people, including the most vulnerable, to meet the basic water, sanitation, and hygiene needs. This, of course, has been critical. Please come back to the previous slide. This has been critical as you know, in many countries, there has been some different degrees of lockdown whereby people needed to stay at home. And then, of course, in many locations, people don't have piped water or private toilet. So then how to preserve that ability to meet these basic needs has been very important. Then guarantee the continuity and safety of the water and sanitation services. And now we are talking more about the service providers. So how have been the water companies, the water utilities, or the small service providers being able to continue working over these very exceptional circumstances and warranting services? You know, there are supply chain involved, chemical products and other things that might have been interrupted, as well as how the workers could just use transport, be protected, etc. And last but not least, providing technical and financial support to the utilities or service providers, because as you know very well, under these circumstances, the service providers has been providing the service to the best possible capacity, but at the same time reducing the income that because either non-payment or waive of tariffs or so. So they are in general in a quite difficult situation. Next slide. So around these 5 blocks that I have just, pillars that I have just mentioned, we have been mapping around 45 different activities in different countries. Please come up, yeah. And then I just want to give a few highlights of what we have seen in general across the countries. So when we look at the results, we could say that in general, there has been like the main effort in hand washing and infection and prevention control, a lot of awareness campaigns and a massive effort in this regard. There have been also exceptional measures being taken to ensure people can access to water and sanitation, both from a technical perspective, for example, reconnecting people that had been disconnected because of non-payment, or delivering, for example, water through trucks for areas that don't have other way to access water. And then also financial measures. There have been reduction of tariffs, even payment holidays, so like you don't need to pay water for 3 months, or even like a complete tariff waive for some time. The service providers have been doing a lot of effort on their end, trying to keep the water workers doing the job. So water people have been declared essential workers in many places, water and sanitation, and trying to keep services running. We have to say that we have seen, compared to water, much less attention to sanitation, and the issue of public toilets in many places has been a specific area of concern. Perhaps some of the other panelists will touch into this, also in India. And the measures have been often more focused on urban areas than in rural areas, which can be in some way normal due to the density and the hotspots and so on. But rural areas also have, and smaller populations also have suffered the pandemic, and there can be very difficult situations related to service provision, both in the short and in the medium term. And overall, while there have been a lot of measures trying to ensure the service in the short term and so on, limited financial and technical support to the water and sanitation service providers. So what we see as a big risk is that many of them have been taking extraordinary efforts, extraordinary costs, but reduced income. And if we are not able to support them properly, there is an important risk for many of them going bankrupt in some way in the coming months. Next. Next slide, please. yeah, then this mapping, no, if some of you say, okay, so what, how has this been useful at all? So I think in many countries, the metrics and this framework with the 5 target areas, the 40-something measures, have been used to hold discussions at the national coordination mechanism. We know of at least 10 countries that are using this, mainly in Latin America, where we have been starting off with this process. We have been producing some notes that you see on the right in collaboration with UNICEF to put out the examples, challenges, and results from this framework, and also disclosing and sharing information between countries and in different webinars in different constellations. Next. So actually, one thing I didn't want to forget is that what we have seen up to now has been more the response during the lockdown phase, right? But as we see that the pandemic is evolving in different regions, we can kind of conceptualize different phases. Some societies are already reopening to some extent to a de-escalation and new normality, where in addition to previous target areas, have to bear in mind new priorities, right? For example, it will be critical the back to schools programs. How are we going to ensure good hygiene, water and sanitation in schools, as well as in public places, markets, etc., right? But then, of course, as I was saying before, as we move on, we have to make sure that we ensure that the service providers remain viable, and if we have been able to make some improvements in the service delivery of some population, that this maintains over time and that we don't come backwards. And last phase is working towards resilience, where we think that we really need to learn from what's going on and be better prepared either for next wave of infection of this COVID, or as to other potential pandemic. And across the board, we have to look at key aspects such as coordination, information gathering, monitoring and sharing, advocacy for the funding of the WASH sector, which has in many countries struggled to be really considered within the national response and be given due attention and funding. And of course, capacity development at the different stakeholders so that we can cope with the new situation, and we as a sector can if possible gain some of the opportunities that this bad situation of the pandemic is also giving. And this is not least that water and sanitation are key, and hygiene are key elements of any strategy and of any society, right? So we need to try to work with this and make some good positive outcomes out of this crisis. Thank you very much, and I leave it here in the interest of time. Over to you, Dinesh.
Thank you, Alejandro. Very good, and I know that it is very difficult to put together 80 country studies in just 5 slides and in 10 minutes presentation, but I'm sure there are lots of questions. So to all the participants, please use the chat box if you have any questions. And I might as well say out at the outset that at the end of this webinar, we will compile and we are recording it, and we will prepare a short report which will have all the presentations, and we will mark it to all the registered participants. So thank you, Alejandro. So hold on to your questions on the chat, and we'll come back as we have time. Sheila, I understand you have no presentation, but maybe ask you to now talk about your experiences from India.
Thank you, Dinesh, and thank you for that amazing presentation. 1 minute, I have to put on my video. Okay.
Yeah.
It's very important that as we study policies, resource allocations of governments, which are critically the most important things to have in place it is also important to acknowledge that in all the countries in the global south that Alejandro has shown, there is a big slip between the cup and the lip as far as the provision of water and sanitation to people who live in informality have. And it's classic in water. For instance, if you took the number of people in Mumbai and you divided the amount of water that comes into the city, it doesn't look bad. But then if you go by who's getting how much water, then the differentials are huge. So I think that's a very important thing now, to connect the policy with the granular reality, not only in order to create a better demand, but also to do what COVID has taught us very, very terribly, is that the absence of poor people to do hand washing in their homes because there is no water, toilets that were built for 50 families now have 500 families using them in community toilets. These are all terrible, terrible outcomes of inefficient provision of water and sanitation. So we have to start with an absolute acknowledgement of the deficits. And we also have to start with acknowledging that the reality of these deficits produce imperfect solutions. And in many situations, those imperfect solutions today have an opportunity to be improved. So the imperfections lie where? One, we are all operating on a centralized sewer system, which was the dominant manner in which fecal matter could be looked at. But in almost all the cities, there is no adequate central sewer system. And therefore, there is a deep demand to find alternatives. There are organizations that are looking for alternatives, and I hope Meera will talk about them. But they're not coming fast enough. They're not coming cheaply enough for them to be adopted everywhere. We're also looking at situations where the manner in which water is brought into cities is producing huge inequities. In most of our cities, the water comes by creating drought in rural areas around the cities. And as metropolitan regions grow, this is getting worse and worse. And in a projection of the scenario 10 or 20 years from now, this planet is going to be very, very full of water shortages. So how do we work out ways for renewal use of water, for conserving water? These are very critical issues, which in most of our informal settlements, we cannot even start that conversation, because you start with no water or water that you buy. I remember many years ago, one of the studies that Meera had done showed that poor people paid sometimes 4 to sometimes 8 times more than what you and I paid for a bucket of water. So in reality, the granular reality of what is happening in informal settlements, not only in large cities, but in medium and small towns, represents a huge deficit in serious governance. Because for the poor, the provision of amenities and facilities represents good governance, a feeling that you can trust your state to provide you with your basic needs. And when that is missing, people try and find alternate solutions which are either environmentally or health-wise not adequate. So I will stop there, and I hope that we'll have some time for discussions. So thank you, Dinesh.
Oh, thanks a lot, Sheila. Excellent. I saved some 3-4 minutes of your time. So hopefully we will have more discussion towards the end. And
because that's more fun than giving lectures.
Exactly. And there are already in the chat box, if you have time, just go through. People are already asking questions on what happens when there is no water and in poor communities, etc. So just keep that in mind.
Okay.
Sujoy, we will come to you now with your presentation. Please, Sujoy and Marai, UNICEF India. Go ahead.
Yeah, hello everybody. I am Sujoy Majumdar from UNICEF India. I and my colleague Mariah, who will be speaking after me, will give you an overview of how UNICEF has reacted to the crisis in India and what are the areas we have done. Could you please move to the next slide, please? So as in the months of February end and beginning of March, it had become quite clear that hand washing with soap was probably the only prevention we had against the coronavirus. And there was a need to promote hand washing in a huge way. As you know, UNICEF has been advocating with the government of India on hand washing under the Swachh Bharat mission, but really it did not get much of a traction. And the focus was mainly on constructing toilets and maybe its use, but hand washing was there, but not that much in focus. And we realized that if we need to do this hand washing, we really need to push hard in our advocacy. 800 million. So basically UNICEF generally works more in rural, but this COVID crisis has brought us into the urban space, and my colleague Mariah will speak about our urban work. But in rural, so there are around 800 million people staying in the rural areas, and how to spread the message of hand washing. So advocacy with the Ministry of Health, with the Ministry of Drinking Water and Sanitation Department and Jal Shakti, Minister of Jal Shakti, uh, enabled us. I think they responded well, and the Ministry of Health and the Ministry of Drinking Water brought out advisories on hand washing. We got film stars and we got other celebrities to really go on the media to talk about hand washing. And I think this message went out quite fast and quite effectively to a large portion of the population. Next slide, please. Then we realize that it's good to say that do hand washing. Now, at homes, there is a study now in India that around 50% of Indian households have spaces for hand washing at home, but still there is a space, and that kind of messaging was happening. But as the lockdown ended and people began to go out, how to get hand washing facilities in our markets, in our offices, in places, in bus stands. And we thought that we need an advisory quickly out. UNICEF in the month of March and April decided to develop a hand washing handbook in which people at the local level could quickly manufacture hand washing stations easily from the material they have with them, and did not involve purchasing some fancy product. So this handbook which is there, and what we did also was to give it to government and use our network and our CSO partners network, and using extensively social media to get it down to every block, 6,000 blocks in the country, and in many states, in the 15 UNICEF states, down to every panchayat. So these are a few of the photographs which I've picked up from the handbook, and it gives you how to build, easy to build, and you'll see the expenditures beginning from 40 USD to around 180 US dollars. So kind of range between 4,000 rupees and to 15, 16,000 rupees. Easy to make hand washing stations, which could be connected to our water supply systems also. And this book, I think, is being used extensively. People have modified it. I know the state of Madhya Pradesh has brought out their own book, and I'm sure other states have also prepared. This is available now in English, Hindi, and Oriya, and all the participants who are here are requested to please look at this book. It could be of useful. It could be of use to you. Please go on to the next slide. This is my last slide. I just wanted to give you some of the other interventions which UNICEF has done in this period. One is we have tried to get our corporate partners to come and basically contribute to the response. If you see the first item is 9 lakh hand sanitizers were given by a corporate partner to the health department of 6 of the most affected states. I mean, they gave in the states of Mumbai, UNICEF facilitated this in Mumbai, in Indore, in Jaipur, in Delhi, in Lucknow. And I think this has become very effective for use in health centers. And I think this was a very positive kind of partnership. Now we are in the process of giving 2.5 million soap bars to health and Panchayati Raj departments across 15 states. This work has started. We, the second point which I've mentioned, we worked with our central and state governments on continuity of sanitation services. Alejandro was mentioning it in UP and all, helping them to quickly get the non-functional hand pumps back into operation, non-functional pipe water system back into operation, working with sanitation workers and waste collectors and providing PPEs for them, masks for them, and hand washing equipment and hand sanitizers for them. So then capacity building, one of the things I want to mention that 200,000 capacity, I mean frontline workers building capacities using net, effective use of the net. So that has been something that I think has worked well. The last point is on assessments. My colleague will speak on this more, but rapid assessments in urban areas. And as you know, over the past couple of months, 40 million Indians have gone from the urban centers to back to their homes. And on the road, in the camps, there were huge issues of supplies, huge issues of food, huge issues of sanitation and water. And that is something we have tried to work with the state governments. So basically, I'll end here. Our focus has been trying to work with the government and with partners about what can actually work on the ground and make a difference. I request now Mariah to come in, please, for the next slide. Next, please.
Okay, yeah, great. So I'll speak a little bit further on the work that we have been doing jointly with the government in urban slums and around the migrant response, and work that we are doing in institutions like healthcare facilities and schools. So in urban areas, we had some small scale city level interventions in Mumbai and Surat, and we were starting in a few other states. But what we've seen is that COVID cases mainly occurred in urban areas. And out of these urban areas, the main hotspots were in the slum locations or the informal settlements. So we really saw the need to expand our work from these few urban areas and from the rural areas to also work at the most vulnerable women and children in urban areas. And the work that we've been doing it's similar to rural areas, but it's very much contextualized to the requirements that are there in urban slums. Now, urban slums are very different in nature from even within the same city. Slum context is very different, and between cities it's very different. So we try to have a two-pronged approach. One is we looked at can we work at the ward level or the slum level and really understand and do micro planning and really understand the issues, and then based on that we come up with different innovative solutions to reduce the spread of COVID and mitigate new cases coming up. But at the same time, taking it a little broader and being strategic and working with the state level and trying to strengthen the capacity of ULBs, the urban local bodies across the state. And we were able to do that really like bringing in our learnings and our innovations from the slum level to the state level. So we had a mix of a state level and a slum level support. So moving to the next slide. Yeah, I won't read all of this because I'm conscious of time, but you could read it through if the PowerPoint is being shared. I just want to highlight a few things. So I think Sujoy already mentioned assessments, planning, monitoring. It's very critical because we need to understand the context. We need to understand the issues, and people in the chat box are also writing like the situation in the slum is really poor. So we need to understand what is exactly that situation, what are the needs, and how can we leverage the resources, not necessarily us bringing in those resources alone, but really leveraging others to bring in the resources. And others meaning there are existing government programs to provide wash and facilities in slums, but also corporates, for example, what Sujoy just explained. So it's understanding the needs, and we were able to do that in quite a lot of locations, also with partners. Then after that, the training, the urban development departments, the Swachh Bharat Mission Urban, but also other partners, and really working at the ULB level, but also at the slum level, the local community toilet operators, the volunteers that go out and do risk communication and behavior change activities, the healthcare facility staff, the staff that is the teachers, volunteers. So it's really a very wide range of different types of trainings for waste pickers, looking at solid liquid waste management, how can people protect themselves, but also how to collect biomedical waste management from COVID affected hotspot areas. So these are all new things that people were not really aware of. And we do think that this type of training will go beyond just dealing with COVID, because it's really a great opportunity to build the capacity of people and expose them to why WASH is so important, and that will go a long way. Moving to the next slide. The other two areas that we thought are really important to focus is on coordination and leveraging. UNICEF alone does not have the funds and the resources to buy 25 lakh soap, but others can contribute that. And if we can help identify the people that need it the most, the health facilities that need that the most, I think that is a really good way of leveraging resources. Similarly, and I'll get back to that on our migrant response. In Maharashtra, we started something called Divan Raat, where UNICEF coordinated a group of 55 or more partners. And I think at somewhere halfway last month, half June, we were able to reach around 1.3 lakh migrants with some essential items. And again, these items were not necessarily procured by UNICEF. They came from all these partners, including corporates. And it was really a good way to bring everyone together and work towards one cause. So in terms of guidelines, Joy already gave some examples. And it goes beyond hand washing stations. It's really also social distancing, physical distancing, but also how to clean and disinfect marketplaces, how to clean community toilets, how often things need to be cleaned and sprayed, the distancing measures. So there's a lot of different technical assistance that was given. The last slide. Yeah, so in terms of the migrant response, and this is closely connected actually to the work that we're doing in the slum areas, because often migrants, they move from the areas in the slum areas towards the rural areas. So again, it's about tracking where are these migrants, where are they moving from and where are they moving to? Can we facilitate that movement to make it a little bit safer? Can we make it a little bit more comfortable? What is it that they need and where will they end up? Or are they currently in shelter homes? Will they have to be in quarantine centers when they reach their rural location? So understanding what are the WASH, what is the WASH situation in that quarantine center that they would end up in? It is it's very challenging to do this because access is difficult and also the situation keeps changing. So we have done assessments, but then a week later or a month later, these shelter homes were closed. So this is a challenge with COVID. We want to make this long-term. We want to build resilience, and at the same time, working with migrants, situation keeps on changing, and you really have to be very flexible. For Washington, I'll need 1 more minute. So for the Washington institutions, I think the situation is that there is more focus on infection prevention and control. But the problem is that the WASH facilities, the conditions have been marginalized. And I'm saying that because health has said, oh, we are in charge, we are controlling this. Hand washing is very important, but then they focus on many other things. So I just want to emphasize, let's not forget the water supply and the sanitation in these healthcare facilities, and we really have to work together with our health colleagues on this. Thank you so much.
Thank you, Marai and Sujoy. I know you have a lot to talk about the effort, but again, apologies for a short time. But I'm sure there are plenty of questions, and Sujoy has been very active on the chat box, replying to many of them. Let's move on to Meera and Meera's presentation.
So thank you for this amazing opportunity to listen to both international experience that CW shared across continents, in fact, and more than 80 countries, as well as the extensive UNICEF experience from both rural and urban areas. And then what Sheila shared from experiences in Mumbai and in Maharashtra particularly. I'm going to actually take a step back, or maybe I should say a step forward, and focus a little bit more on what our title says, from response to resilience. So what is this resilience that we are talking about, and what would it entail? We have also done a little bit of work. I mean, our work is obviously limited in scale and scope, but we have worked in the cities where we work. We worked with municipal workers and the other sanitation workers to provide PPE arrangements for ensure that the scheduled emptying that has been going on for the first time in the country, in India, in 2 cities in India, and this has continued without any stoppage in these 2 cities throughout the COVID period. So it's quite amazing kind of achievement. We've also, there was a lot of discussion on hand washing, and we've taken this opportunity to ensure that our cities where we work, hand washing facilities are provided. And we've also tried to mobilize philanthropic funding for this, so looking beyond just the government. But I said that I want to take a step forward and talk a little bit beyond just the usual COVID response to WASH, and look at how do you ensure resilience in the future. And my argument is that beyond COVID, if we really want our cities to be resilient, or our local government areas to be resilient, then we need to focus on strengthening of local governments. This would mean strengthening their financial abilities, their institutional capacities, the kind of service delivery models that they use, and so on. And what can be done about this? And I want to bring in alliance that we are, a lot of, I think, people on the chat, who have joined, participants also probably are member of, is the National Fecal Sludge and Septage Management Alliance. Sheila referred to this, that sewerage systems are not there in most cities, and where they are there also, they don't often work. And an option which is quite feasible, far more economical, and far more equitable, and because it is also far less costly, is the fecal sludge management system. And this is something that we have been supporting government of Maharashtra on. Currently, this is going on across about 100 cities where new fecal sludge treatment facilities are also being built. But it's an alliance that has taken, NFSSM Alliance also has taken a stand that it is important that if you want to ensure sustainability of the kind of effort that all of us talked about, then you have to have very strong local governments. And because we talk more urban, it is municipal governments. So we formed a special task for this, and we refer to this as obviously Municipal Strengthening Task Force. As a part of this, we are trying to see that what is it that we will need to do to ensure that our cities remain resilient, our municipal agencies remain resilient to respond to this crisis, as well as not only the crises that come, but to ensure that services are provided equitably, inclusively. Again, Sheila referred to the fact that this is not the case in most of our cities. She referred to an incident which was probably, I don't remember, 25 years ago, but currently still we face similar situations. So that's something that we certainly need to work on. So those are things that we are working on. If you look at municipal government strengthening, that in the case of India, it was a 74th amendment, constitutional amendment, which actually gave constitutional recognition to local governments and provided for certain functions that were to be mandated by local governments. Of course, the constitution did not clearly address this. They said state governments will actually ensure that. Luckily for us, I think in most states, there may be a few exceptions, but in most states, wash services are certainly the function of municipal governments in urban areas. And that's what we are more familiar with. But even for rural areas, given the kind of program which follow on from Swajal and so on, that rural local governments are often in charge. So that's something that to keep in mind. Now, if local governments have to provide all these services, ensure their sustainability, then they must have financial resilience. And this, we argue, has not been the case. If we want, our cities are the ones where 60% of national GDP is generated. And yet, of the total government expenditure, municipal expenditure is hardly 1% of the total. If you look at international, and going back to CV's thing, if you look at international examples, then a large number of countries transfer considerable amounts through what are known as intergovernmental transfers to municipal governments. In many countries, this is as much as 6 to 10% of GDP. In India, it is less than 0.5% of GDP, which means that we are not providing the kind of financial resources that are required in our urban areas. And this is something that needs to be kept in mind. We have a federal structure, which means state governments also play an important role. And under the constitutional amendment, state governments were mandated to provide or formulate state finance commissions and then ensure that local governments got transfers. Although state governments do provide transfers to local governments, the state finance commissions are almost absent throughout India, barring a few states, barring a few exceptions like Tamil Nadu, Kerala, and Karnataka. This has not been the case. And this is actually really a missed opportunity that we really need to go back and look at. Not only that, the resources that were with local governments have also been often taken away. In the old days, octroi was taken away. Maharashtra had a very, very good tax in local body tax. This was also taken away. Now with the coming of GST, almost many other taxes are also being taken away, which means that local governments don't have many own resources except essentially property tax. And this is something that we need to keep in mind. GST, unfortunately, is being shared only with central government, union government, and state governments. There has been a lot of arguments and discussion even in the parliament. Recently, last year, Vijay Kelkar, the ex-finance secretary, also talked about that a share of GST should have been allocated to local governments. This has not happened. And this is something that actually still requires debate and discussion, because that will really ensure that local governments will have adequate resources. There is a tendency for national and state governments to really always harp on local government owned resources. The recent FM announcement about urban reform incentive for state borrowing also talked about property tax. It is true that property tax is a very, very important own resource for local governments, and this needs to be tapped more efficiently, effectively than is currently being done. But many states have started to do that. And many states have started to do that. And we find our analysis shows that some states like Gujarat, Maharashtra actually have reached like international practice. There is not much more that probably can be done. Also, that property tax, there is a limit on what the small and medium towns can actually do. So these things we need to keep in mind. as we talk of financial resilience of local governments. And I'll add one more thing and then stop. In terms of institutional strengthening, there are many aspects that need to be focused on. I'm just going to talk of two aspects only. One is on monitoring. There is a lot of talk going on these days with smart cities and use of data and so on. But this needs to be done well. That digitization and use of GIS, use of tools to really monitor our service provision much better needs to be done. CWAS-CRDF-CEPT and CRDF has worked on this for last 10 years on what we refer to as a performance assessment system. We work in more than 900 cities, another 400, all smart cities and all Amrut cities are being added to this. So it's something that we need to look at. This will allow us to monitor the actual service provision in our cities. And similarly, there should be use of mobile apps like that can be used to monitor services at a local level. Finally, let me stop with one, and Sheila referred to the importance of community, and this to my mind is very, very critical. There has been NGO-led community, but there has also been this huge development of self-help groups. It's far stronger in rural, but even in urban, there are large number of SHGs and who have become very, very active in local development, provision of local services and monitoring. And this is something that we need to tap on as much as possible. So let me stop here, that these are issues that we are actually discussing in our municipal strengthening task force as part of the NFSSM Alliance. And maybe hopefully the next webinar of Water Governance Hub can focus on these issues in more detail. Thank you.
Thank you. And I know you have a lot more to say, but short of time. And now we'll move on to the final presentation and hope Deepinder will stick to his 10 minutes so that we get some discussion time subsequently. Deepinder, over to you.
Thanks, Dinesh. Thank you. And on behalf of CWAS, CWI and NIUA, I would also like to thank all the participants and panelists who have been part of this discussion today. What I'm sharing here in my presentation is a response and resilience work which we have been engaged in at NIUA. So the idea here is, I'm not going to repeat a lot of things which the previous panelists have shown, but it's more like a hands-on nuts and bolts process I'm likely to share with you. And I hope that makes sense. Next slide, please. See, we started with an emergency response with our modest efforts. We don't claim that we, at NIUA at least, we didn't have a field-based response. We looked at how we can support an emergency response for sanitation workers. So our focus was on protecting and PPEs and protective gear for the sanitation workers. So we identify 3 kind of challenges in our response. And as Meera said, these are systemic challenges. One is knowing actually the number of workers which are there, because that data itself is not available. Then planning a response. How much should it be? For what kind of protective gear? And finally, the operational priorities of how will you actually deploy and undertake both solid and liquid waste management. So these are the 3 kind of practical issues in terms of response, which frankly, we don't see emerging from many international or national perspectives. Next slide, please. So what we did as a response was we prepared an e-resource book as part of the Alliance, which is mentioned in the opening slide. We are also part of the National Fecal Sludge and Septage Management Alliance. So we quickly tried to compile an e-resource book which made sense in terms of that it provided separate compartments or chapters for Government of India advisories, for knowledge resources, and for ULBs to actually how to prepare proposals for protecting the sanitation workers. So we felt that the response has to make sense from our perspective, unless it is the last one on proposal development and actually getting PPPs on the ground is not done, then e-resource book doesn't serve much purpose. We also undertook, once we had an e-resource book, as I said, and a process we moved to capacity development, we exposed that to the, as TOT to our national nodal training institutes. In one state where we are working on the ground, we used it as a training for ULBs there. And as we were doing this, other states approached us and said, can we do something on sewer cleaning? In Rajasthan, this demand came. And we said, well, we are doing on PPEs. They said, can you also do safety in sewer cleaning? So we tried to even support them with that. And also, of course, incorporating all of this in our regular training modules. In terms of advocacy, we initiated a set of webinars with the Smart Cities mission. And with the research group which we had, we tried to identify topics for research. In terms of an urban resilience framework, if you see again in this process, while we were all doing all this, this was coming up naturally. And we studied, commissioned a study with AILST just to understand how a few towns are responding. And while they were trying to develop a framework for understanding the response, we tried to develop a resilience framework. Next slide, please. These are quick slides. I'm not going to go through each in detail. Even these are some of the learnings, because this is an international webinar. I think it's important to share some very practical, very real life lessons. So this is a hierarchy of safety controls, which the Tamil Nadu program, IIHS, they presented in one of the webinars, in which they said the PPEs actually come last. What comes first is prevention, mitigation, and then protection. So this was a very good kind of a lesson, which we used also extensively in our training. Next, please. This is just the resource book cover and the link, and you can access it from there. Next slide, please. So coming to the resilience framework purpose. Here again, the purpose was not to either judge or not to just create a framework, but to have some practical use. So one of the first purpose was how do we strengthen the existing urban systems, and through the practical assessment of a COVID urban sanitation response. So here our focus was on strengthening the urban sanitation systems. The second purpose was how we can contribute to the effective response as it is happening, and it's happening even today. I remember when the first webinars on COVID started, everybody was saying post-COVID cities, post-COVID scenario, but we are still at the cusp and not even reached the peak. So I think the importance was how this framework can actually be used even in the rising pandemic. And the third was also, the most important was how to have a framework for assessing the effectiveness of the present and future urban sanitation responses. So I think this is the practical purpose with which we were looking at it. We were not interested in creating too many parameters and too many indicators to watch. So the last slide which I am presenting, next slide please. So this is a very simple practical framework we came up with. It can be used as an urban sanitation resilience framework and be applied anywhere. And there are these, and it's based on practical experience. It's not based on theory at all. So for example, we are looking at 3 parameters: timeliness, appropriateness, and effectiveness of the response. And through this, we are measuring the resilience of an urban city or an institution.
Question.
So in timeliness, we observed, for example, based in our homes also, that there was a work stoppage. For a week or 10 days, the person who was coming for garbage collection wasn't coming. For a week or 10 days or 1 month, the septic tanks desludging operators were not moving. For some time, the existing other sanitary infrastructure had also stopped. So what was the timeliness? What was the swiftness with which resilience is measured by the ability to recover from shock? So timeliness of the shock, how much time did it take? Appropriateness. The second indicator, if you see, looks at the service level coverage in critical areas, coordination mechanisms and the effectiveness of the coordination mechanisms at the ULB and state level, and deployment of your workers. Unfortunately, what we have seen in most organizations and most cities are only reporting innovation. And that seems to be more like a public relations exercise, that we did this, we did that, but it doesn't actually count much. In terms of effectiveness, if you look at the health sector, we need to learn from the health sector that strategic deployment of health staff was the core of their strategy for health. Was this actually applied in the sanitation of public spaces, liquid waste management, solid waste management? I don't think it was. Similarly, emergency measures taken, and what was their outcome, even if they were innovative measures? What happened to the treatment of COVID-infected waste? What was there, any plans? We had several interactions with ULBs, and they all said, we actually don't know how to deal with it. And finally, the systems improvement. So this is, in nutshell, the kind of very simple framework in which we want to use it as a learning framework, and it can be applied in other urban emergency, sanitation, urban emergency response. Thank you. I think this was the last slide.
Thank you, Dapinder. And I hope that, I'm glad that we managed to conclude discussions, presentations as planned, although we would have liked a little more time. But we still have next 15 minutes for discussion. What I would like, I hope that panelists have managed, because I see many interactions on the chat box. One of the key things that has emerged from Sheila, UNICEF, Mira's presentation is in terms of lack of adequate wash facilities for urban poor communities. Sheila alluded to the fact of unequal service provisions in our cities. So I think that's one challenge. The second challenge, I think, is that globally, which are the countries, I think I saw somewhere a question to Alejandro, which are the countries that have actually done better in terms of their response to the COVID situation, and that for Alejandro. So maybe we will begin with this question one on unequal wash facilities in our poor communities, and any one of these, either Sujoy, Sheila, Mira, anyone who wants to take this on as a question. And then Alejandro, on which is the country that you think has better situation out of your 80 countries in your matrix. Maybe Alejandro first, and then we'll come to Sujoy and Sheila and Alejandro.
Okay, thank you. That is a difficult question because what we are mapping now is also like the public policy response. So many countries are announcing they are doing things, but the quality of implementation is also very relevant, because you might have, you might have good intentions, but then not good implementation capacity, right? As I think all the panelists have mentioned as well. But just to provide an example, I think one country that comes to my mind that started moving quite fast was Colombia in Latin America, where from one end, they started controlling the cases early on, and then starting doing exceptional measures for access to water and sanitation. Among them, ordering the reconnection of people that had been disconnected due to non-payment, and also delivery of water to areas that didn't have connection. And this, I mean, the good thing is that this started to be implemented quite quickly, and over a matter of a month or so, they had connected more than 250,000 households, and that was a good part of it. But then there are also like other voices that were coming, no, in terms of the rural areas, for example, that have been a little bit less considered, and then they were planning to roll out technical assistance and support to the rural service providers. But then of course, these are a few good ideas. I mean, good measures that were taken early on, but yeah, every country is struggling in their own ways, right? Because, for example, the same country now is still, even if they started early and so on, it is not now like flattening the curve very much of infections even so. So then there is also the problem of how much can the countries be in a certain degree of lockdown socially and economically, and that is a real challenge in many places. I stop it there.
Yeah, thank you. Okay, want to take the Sheila?
Can I? Yeah, I just want to, in the spirit of following Alejandro, some of you may know that I'm part of a global network called Shack Dwellers International. One of the things that we do is whenever we have a federation in a city, we do what we call slum profiling, in which we identify every single informal settlement and we look at their basic amenities, services, land ownership, and things like that. We have not yet found a single city which actually has mapped all its informal settlements and actually knows what are the deficits. So this is a serious, serious challenge. The second thing that I want to say is that let's take, for instance, in India, the Swachh Bharat mission and the sanitation challenge. In so many of the medium and small towns in which we work, there is 55 to 65% households who have built toilets in their house as per this. But the city is so excited of saying that they are open defecation free that they make that announcement. And when communities tell them that, but there are so many settlements where there's open defecation, can you give us money to build toilets? They say, no, we've already decided that we have already announced we are open defecation. So what I'm trying to say is that we need to look at these challenges with a very granular understanding of valuable use of information gathering and its ability to produce serious universal access. Because, I mean, the reality is that sanitation, if we have a prime minister who talks about sanitation, that's great. But to make him happy, if you give wrong information, that's not good enough. So what role do all of us play as NIUA, as your work in CEPT, us as people? What do we do to make sure that information gathered, whether by communities or by intermediaries or by state institutions, identifies real-time benchmark and solves it? Otherwise, we keep, you've been doing this for so long. So how long are we going to keep doing that? So
maybe UNICEF, how do you approach? Do you actually gather information or you just respond to the requests?
Yeah, so before Mariah speaks, maybe I'll just come in for a minute. I'll just, good points we just heard from both Alejandro and Sheila. But I am somewhat of an optimist, and I prefer to look the glass half full than half empty. I think that there is a positive response from government. Is it ideal? Possibly not. But there is a response and we need to work on that response. So there are two things I'd want to say. One is what Alessandro mentioned about water supplies being, connections being disconnected in parts of South America. Luckily in India, we don't have privately managed water supply and all are managed by government. So we did not have that problem.
Two, three cities.
Yes, 2-3 cities. Generally, rural area did not have it, and luckily we had not. But we did face a situation wherein when we had this 100% lockdown for more than 6-7 weeks. At that time, many of the hand pumps were not being repaired. If they went off, it went off. There was no one going there. So that luckily we could advocate across quite a few states and try to assist to bring that back online. So that is, but there is still work to be done. I'm just saying that these are the kind of interventions. So whenever we get information that this is an issue, we try to galvanize the collectors and the executive engineers and the Jal Nigams and the PhDs to really move, look at that and try to solve that particular problem. The other issue I just saw is the thing I just want to say for a minute. This was a discussion going on in the chat box about this hand washing, and you know, it's a huge task. We have 250,000 gram panchayats, 650,000 villages, each, and there are villages in Bengal and UP and Bihar which are massive, at 8-10,000 people. You have multiple markets and offices. So, but one of the things we're discussing in the chat box is how does the behavior change happen? There has to be a push. One of the good things now is people are scared and we have fear. That can be a strong push for behavior change. But whether it can be sustained is another issue, because behavior change based on fear may not work. I don't know if you're aware, I'm sure you've heard UNICEF and World Health has, I think, a couple of days back launched a hand washing initiative globally to try to push the issue with governments. We need investment in this. And I think governments at the field level, the collectors and the CEOs and the BDOs and the Gram Panchayat Sarpanches and members are coming around to that. They realize that if they have to prevent COVID in their areas, because see, in rural areas, health facilities are a disaster. If it strikes, people will not get a medical facility to go to. So we really have to work on prevention. The health department has to work on preventive medicine. And so we have the money. It has to be focused. We need to push the agenda with governments, with administrators, and with gram panchayats and local bodies and SHGs. Over. Mariah, you want to come in?
Yeah, just to add a few things, I think the equity issue is really important, and I think COVID could potentially make things worse. What we've seen, and in the chat box, I saw MHM, or menstrual hygiene management, addressed as one of the issues that is not really looked at. So one of the things that has happened in India, the schools are closed, Anganwadis, the preschools are closed, and they were often used as areas for distribution of sanitary napkins. Now, if these points are closed and the napkins are not available actually in rural areas because the supply chain is not functional because of lockdown, that creates a lot of issues. So one thing that we have done is in wherever it was possible, not across the whole country obviously, but wherever it was possible and we were aware of issues, we were able to advocate with the government and the departments who usually provide the napkins to see if there could be different distribution points or leverage supplies from corporates. So that's an example of how we had looked at where are the inequities increasing due to COVID and how could we address these. One other example is we had some secondary data available for Ahmedabad, specifically in the slum areas, and we analyzed where are the COVID cases the worst, where is the slum population the highest, where is population the densest, and where are the wash facility access the lowest. And we saw that there was kind of an overlap. So highest number of COVID cases in the locations with the highest slum population density and the worst wash access. So that was very clear for us. This is where we now need to start working. So this is the type of equity issues that we're trying to address, but yeah, it's very difficult.
Okay, thank you very much. And I think we are coming close to our end point, unless our participants and panelists can extend for 5 more minutes. We are coming close. What I'm going to do is, Sheila, you had raised your hand, so can you come back? I don't know what, I cannot see your video, but if you had a point to make because I saw your hand. So go ahead, Sheila. Unmute, unmute. Sheila, unmute.
I've already.
Sheila, unmute.
Okay, I did.
Now, no, go ahead.
No,
quick.
I want to tell Sujoy that the issue is not about being an optimist or a pessimist. It's to do with experiences of 30 and 40 years. You cannot, I think none of us would be in the wash sector if we were pessimists. Because the kind of delays that we have had dealt with really demonstrate a serious lack of governance, not only in this country, but all over the world. So I think it has to be, I mean, let's not do a PR thing here. The reality is this is a serious, serious challenge. And COVID has brought it out, and we have to, I think we should end this by saying, how do we all work together to ensure that access to water sanitation, the thing that you were saying about, addressing young women's, especially young girls' menstrual challenges of getting sanitary napkins, young kids getting food. All these things are serious, and the amount of challenges that we are going to face in the future are going to get worse and worse if we don't deal with this. So when I say these things, it's not to just keep saying that the state is bad. The issue is this has been a global negligence. We have to deal with it from global to local and develop new partnerships to make that happen. So that's what I want to say, that it's important that we grab the opportunities that COVID gives us by opening these doors that demonstrate that hand wash is transformative, good wash facilities are critical, and make this work for everybody. That's what I'm saying.
Thanks, great. Depinder, what we will do is the final round. We will have Depinder, Meera, and Alejandro, and then Sujoy, Marie. I mean, in that order, final round. Depinder, quickly, your 1 minute.
Yeah, I just wanted to put my concluding 2-3 points. One I fear is that we will quickly forget what happened. So therefore, while understanding, documenting response and resilience, we should also document what actually happened in the first 30 days, what happened in the next 30 days. So that is very important. There's no point making general statements of good intent. Secondly, I feel system strengthening when we are talking about what happens to health insurance, accident insurance, incentives for sanitary workers. They are part of system strengthening. If we don't look at that, then any disaster comes, we are all the more worse off. So we need to be very careful so that we don't go on to standard cliche kind of wash solutions and wash priorities. And frankly, this has to come from the global south. It cannot come from the global north. This pandemic has not hit the global north as it has hit the global south. So I think these kind of, in the terms of slums and those issues which we are dealing with. So I think those priorities, systems, frameworks should emerge from here. And that is very important based on our experience, and these kind of webinars should help in generating that. Thank you.
Thank you. Meera, quickly. I just speak from my system.
Just to say that I don't think it is only the pandemic that is making us aware that global north has to learn from global south. We have been discussing this, and I've been discussing with GWP at SIWI, many international events, with IRC all the time, that global north has to learn from global south. I think there is much more happening that is innovative in our areas, and I think that lessons have to go there. So I don't think it's that way. I just want to say, however, that the point that I was trying to, that if we are talking not only of immediate responses, you talked about documenting those, but if we are talking of resilience and how do we ensure that our city governments, our rural local governments are better prepared, then I think some of the issues that I was talking about in terms of systems changes, in terms of municipal finance or local government finance, the service models that we use, what Sheila is talking about is also really actually reflecting back on the kind of service models that we use. So I think those issues we should not forget in the heat of the moment for COVID.
Hopefully vaccine will come. 6 months down the line, we'll be looking at a very different scenario, but the systems changes will still persist. And we need to attend to those.
Thank you. Alejandro, please unmute.
Yeah, thank you. I think Mera did it so well that I don't have much to add. My point was also to see now we are in the heat of the moment, as she said, but we can't forget the long-term and enabling environment and system strengthening, as it has been said. So trying to also do things in a way that we can build on into the future and not do some interventions that might then like go against the sustainability of service delivery after the crisis. So yeah, I think we are all aligned and willing to learn from each other. We pass the word to UNICEF.
Over to UNICEF, final word, if you have any. Sujoy, Marai. Sujoy, unmute, yes.
Yeah, thank you. Yeah, thanks, Alejandro, for the ball. We're happy to get the ball, but we need all to hold the ball together, as you said. Otherwise, it is tough. The situation we have now is a situation which we obviously could not have ever anticipated. The fact is, we are we had a reasonably successful sanitation program for Swachh Bharat in rural areas at least. The government has said they're looking at a Jal Jeevan mission, which will give household connections in the next 5 years. I don't know whether the investment plan will really be available now in the frame that's available, but we are really keeping our fingers crossed. And the hygiene focus that has come because of this pandemic, hopefully will be inculcated with a significant, by a significant portion of the population. So, but obviously this will not happen on its own. And there has to be huge engagement at the ground level, at the state level, at policy level here in Delhi. People have to put in the money for it. We are trying to work with the Ministry of Jal Shakti to say that you need to provide funds for hand washing. How do you do that? Other schools that are being opened now will be opened soon, hopefully. Will they have this kind of facilities? Is the water coming? Do you have an overhead reservoir? Do you have soap? One of the meetings which I attended, the participants from Bengal, after the Amphan Amphan incident, cyclone, they were repeatedly asking me a question that you are saying soap, where is the soap? It costs 15 rupees to buy a soap. So what I had mentioned is that each person should have one soap. Please don't share soaps. And they came back to me very hard to say that you are living in a fool's paradise. How do you expect a house of 8 people to have 8 soaps? So I had to say, why don't you buy a soap and cut it into 8 pieces? There are solutions that we have to think. I don't know whether my solution made any sense to them. They must have thought that I'm an idiot or come from where. But these are situations we'll have to see. Rajasthan does not have water. I was in a meeting yesterday, they said, where is the water? We're talking about hand washing. We hardly get enough to drink. So it's just like that France Queen, he said, if you don't have bread, eat cake. It's that kind of thing. You don't have fundamentals. So obviously we need partnerships. We need to work together. We need advocacy at all levels. But we need to fill in the gaps where government is not able to. And if they are making mistakes, if there are gaps, that is a place that I think our role has to come in. Over.
Thank you. Marai, final word.
Yeah, final word. I think we've seen great success in the last 5 years in the Swachh Bharat mission, and it was truly the leadership of the government that helped to get so many people access to latrine. Now something similar is ongoing with the Jal Jeevan mission, but I think hand washing and hygiene is still left out. So I would really hope that we can see more government leadership at the highest level for hand washing and make this ambition. I think that is something we would really need, and COVID is a good opportunity, but honestly, I have even personally already noticed that my hand washing practice is not the same now as it was 2 months ago. So even I am getting lazy. So I think this behavior change is really something we need to keep pushing, and it needs this type of leadership. And it requires water, it requires soap, and it requires all these resources. So with the implementation of JGM and the Swachh Bharat mission too, I think it's really a good opportunity to ensure that this is really taken forward. The other thing, we, like I mentioned before, we really have to work together with our health colleagues. It's a health-led response. The issue is that I feel WASH is actually losing visibility right now. The focus is stronger on health. It's focused much more on infection prevention and control. And there's less attention for WASH. If we say we have to wash hands, but there's no water, how will that happen? So health cannot ignore us. We have to keep putting our feet in between the door. Thank you.
Okay, thanks a lot. Great. We've taken 10 more minutes. So I thank the participants. I thank you, all the panelists. I'm not going to summarize. I think there is some exciting discussion going on the chat box. Our team at CWAS, I'm sure, not only that we are recording, but somebody is going to summarize very soon. So to all the participants, to all the panelists, we will share the material once we put it in some shape. And thank you all. I think this is the beginning of a partnership. We are happy to welcome other interested members in the partnership of the WASH Governance Hub. As I think we have all discussed, there are issues of governance, issues of unequal service provision, especially in the urban slums, but also the institutional issues that Meera was talking about. How do we strengthen the local governments? NIUA is working hard at it, but how do we collectively build partnership that Sheila was saying, that it's not one agency, one institution role, but how do we put together? I was just looking at the 6 panelists, and I said that collectively they probably have 200 years of experience amongst them. And
We are all old people.
How do we put together all of these experience and come up with strengthening and making our cities resilient? So, and as Sujoy is saying, we are all optimists here, and we do hope that we will be able to make that change. So thank you all, and stay safe, take care. Bye-bye.
Bye. Thank you.
Mm-hmm.